Howdy, Aggies, and thank you for being here. In today's workshop, I'm going to talk about how to become competitive for BA school beyond academics. In today's workshop, I'm going to discuss the difference between patient care experience and healthcare experience, tips for gaining healthcare experience and networking effectively, and how to make the most of your time at Texas A&M. One of the questions I get the most is what's the difference between patient care experience versus healthcare experience? When we talk about patient care experience, we're talking about you being in a role where you spend 50% or more of your day interacting with patients and or being responsible for your patients. So this can look like as prescribing medication, performing procedures, directing a course of treatment, or simply actively working on a patient. The easiest way to find opportunities where you can gain direct patient care hours will be by getting certified. There are plenty of certifications out there. My encouragement is that you do your research and see which one works best for you in terms of your timeline, budget, and also your interests. Certified Medical Assistant is one of the most popular certifications. However, you're welcome to choose any certification that, again, will allow you to be in a role where you can be responsible of patients. Now, when we talk about healthcare experience, that means that you're working on a health-related field where you're not directly responsible for a patient's care, but you may still have patient interaction. This can look like filling prescriptions, cleaning patients, working as a scribe, and even volunteering at the St. Joseph Hospital. Also, even though shadowing is not required, this is something that I highly, highly recommend. I recommend for you to shadow different PAs in different settings, and this can look like primary care, dermatology, cardiology, or in a hospital, because it would allow you to better understand what their day-to-day looks like. This can be helpful, especially because when it's time for you to write your essay and talk about why you want to become a PA, there could be things that you can highlight from your shadowing experience. Another question I get a lot is how many hours of patient care experience do I need? So some programs may require a minimum of 500 to 1,000 hours of healthcare experience. However, this can vary per state and also per PA school. Not all schools require experience. However, it's very important for you to have some sort of experience, especially because for some school, the average patient care hours or direct patient care hours tends to be 2,000 to 3,000 hours. So my recommendation is, especially if you're starting early, try to get at least 1,000 hours of direct patient care, so that way you can make yourself a bit more competitive. Now let's talk about finding shadowing opportunities. Finding shadow opportunities tends to be a bit challenging. I know I also get a lot of questions about like how to get shadowing hours or how to meet with PAs. So these are some things that I typically recommend students to do. The first one is to reach out to a wide range of healthcare settings. So that can be hospitals, outpatient clinics, women's care center, nursing homes, and so on and so forth. Sometimes it might take you to go to the physical location and ask, especially if they're not answering to your emails and phone calls, which is very common, unfortunately. A lot of students tend to seek opportunities over the summer or winter breaks to shadow PA from their hometown. So this is another thing that I also recommend. It is often easier to get hours this way due to the large number of students pursuing limited spots in College Station. Also keep in mind that volunteer programs at hospitals are a common way to get shadowing hours. Networking is very, very helpful, and this is another thing that I highly recommend. As an Aggie, I recommend for you to use your Aggie network. If you go to the Association of Former Students, you will see a tab where it says Find an Aggie, where it will allow you to search for Aggies in a specific city, town, who have classified themselves as a PA. This can be very helpful, especially because a lot of these Aggies, they do have their contact information. So you can reach out to them and see if they're willing to meet you and let you shadow for a few hours on a specific weeks. Another thing I recommend is to join Future Aggie Physician Assistants, also known as FAPA, which is a student-led organization, and they're amazing. They're a great organization. They provide lots of opportunities for their members to engage in, whether it's through volunteering or social events, and also it's just good for you to meet with other pre-PA students, pre-PA Aggies, so that way not only you can build community, but also you can refer each other to the places where you're working or essentially just learn more about other opportunities. Another platform that you can use is Hire Aggies, and also there's LinkedIn. If you are not sure how to use LinkedIn, I recommend for you to meet with someone in the Career Center that can walk you through how to build a strong profile and how to use this platform. Lastly, I will say join the PPA listserv if you haven't already. So the PPA listserv, basically we send updates and announcements as well as volunteering opportunities or relevant workshops that you may find beneficial to attend. So if you haven't joined the listserv, I highly recommend for you to do this. Speaking of networking, if you feel nervous about writing an email to an APA, know that there is a workshop that you can watch is on our website, on our YouTube page. And here we're going to talk about how to write a professional email. So you're welcome to scan this QR code and watch this video to help you feel a bit more confident when it's time for you to reach out to PAs. Okay, let's talk about volunteering. Volunteering provides a meaningful opportunity to take on responsibilities and make a positive impact in a workplace organization. Even though this is not required by PA schools, this is something we highly recommend for you to consider uh, because a lot of these PA schools do value when students are out there supporting others and essentially giving freely of your time to support your community. So I recommend for you to identify a population or cause that resonates with you and inspires you to take action. This can look like working with children, women, the elderly, or even with people with disabilities. Some of the causes that you can think about could be feeding the homeless, it can be teaching, you can think about mental health advocacy, disaster relief, or even volunteering at a local church. Also keep in mind that Texas A&M has over 1,000 student organizations. This is another thing. It could be healthcare and non-healthcare related. Number one, it's good for you to join a community and do something that you're really passionate about. And also a lot of these organizations do, they're very involved with their community. So that can be another way for you to get volunteering hours. And as I mentioned before, most pre-health admissions representatives want to see that you give freely of your time to support your community. Also, I recommend exploring the school's values and culture, so that way you'll know which schools do value it more, and hopefully motivates you even more to be involved. If you need help with finding other volunteering opportunities, our office has a handout that you can use to find opportunities in the area. So you're welcome to scan this QR code to get access to it. There's also a handout where we have a list of summer camp opportunities. Reflection, reflection, reflection. This is so important. no matter where you are in your journey, whether you're a freshman, sophomore, a junior, or senior, I recommend for you to always take a moment at the end of the semester, at the end of the academic year, to reflect on the experiences that you gained so far, on the things that you have learned. And these are some questions that you can ask yourself. That way, again, you can just reflect on what you'll learn and also think about whether you want to continue to do that thing that you're doing or you want to explore other things that you may be interested in. So think about, how does this experience shape and mature your understanding of the profession? What experiences challenge it? So this particular question is something that you can ask yourself when you think about your healthcare experience or your patient care experience. So again, think about how it has helped you shape and mature your understanding of the profession and what have been some challenges that you have faced. Also think about whether or not you spend enough time shadowing or getting exposure to understand the realities of the profession. This is something that oftentimes we tend to overlook. So it's important to think about um, not only um, not only to meet a certain amount of hours, but really think about the quality of that time that you spent with patients and see if you may need more time, whether shadowing or working with doctors and patients. You can also think about moments where you felt uncomfortable in a service setting and what did you learn. And this is a very, very important question. And again, I feel like oftentimes students tend to overlook, but really encourage you to think about what ways you're recognizing and utilizing your interests, skills, and talents. Again, yes, I understand PA school is the goal. And also, there's so many wonderful things you're good at, skilled at, and that is something I want you to ask yourself every semester, every academic year. Really think about, what are you good at? Not only think about the things that you need to do, the things that areas you need to improve, but also think about what talents you have already and what are some things that you can do to continue to strengthen those talents and interests and skills that you have. Last but not least, I recommend to stay curious, keep an open mind, and be willing to make and learn from your mistakes. I also wanted to talk about some traditional pathways. And disclaimer, if looking back at your journey, if it doesn't look like this, it's totally okay. I want everyone to understand that your journey is your own. I wanted to have some sort of like framework just in case you needed a bit of guidance, especially if you're just starting as a freshman of sophomore. But this is not how it needs to look like for everyone whatsoever. It's just a little bit of guidance. So, if you're a freshman, my recommendation is to take the time to get acclimated to Texas A&M and college life in general. This is a big transition, so I want to make sure that you do take the time to get acclimated to this new stage of your life. Of course, I recommend focusing on academics. What worked for you in high school may not work for you in college. So definitely take the time that you need to study, to practice those study skills and see what resources you may need now or in the future. I also recommend building your own community. You can explore student organizations and hopefully you'll make some friendships in the classroom. So because it's your first year and it can feel a little bit lonely sometimes, it's good for you to find a community where you feel supported. Also, it's important for you to identify the available resources on campus and just overall explore your interests. As a sophomore, as you can see, academics continues to be important and it will be important every single year. So, in addition to that, I would say continue to explore your interests, begin to network, and start. to get connected with a PA so that way hopefully you can start shadowing, and also look into certifications, and just reflect on what ways, what roles you're interested in and how you want to start gaining patient care experience. Junior year, similar, focus on academics, networking, shadowing. So basically more of what you did in your sophomore year. I know a lot is not a lot, but a good amount of students tend to apply to PA schools during their junior year. Keep in mind that you do need to complete all your prerequisites before you apply to PA school. Even though some programs may have different deadlines for the prerequisites, I highly, highly recommend for you to have most courses completed, if not all, so that way you don't have to worry about that later. So, for those who are looking to apply to PA schools during the junior year, typically they take the time to prepare and take the GRE and complete their CASPA application. So for seniors, again, very similar. It's more shadowing, more gaining healthcare experience or patient care experience, preparing and taking the GRE. And some students, they also plan for their gap year, which we'll talk about in a second. Okay. Thankfully, gap years are becoming more and more common, which is great. So I wanted to talk about what are some of the most common reasons why students choose to take a gap year or many gap years after graduating. So the most common reason is to improve academic performance. Some people had a very challenging time in undergrad. Others, they realized they wanted to pursue this career path later on. Maybe they were majoring in something that they were not necessarily interested in, or it was very challenging and they didn't do so well. So there's all kinds of different reasons why students have a difficult time in undergrad. So, for those who don't have a strong GPA, typically I talk about looking into pursuing a master's degree or a post-bac program. That way, they can make themselves more competitive in terms of their GPA. The other reason is to gain more work experience. You heard me at the beginning. The average of direct patient care hours of applicants for some schools tends to be from 2,000 to 3,000 hours. So some students like to take that gap year to gain more patient care experience because it can be hard. It's a lot of things that you need to do while you're here. So if you were doing all kinds of different things while also making sure that you're doing good with your classes and academics overall, then yes, like some students decide to take up here so that way they can get more hours. Another big reason is to save money. This is big reality. So if that's you, if you just want to take that year to save money so that way you can pay for PA school or cover other expenses, that's totally valid. And last but not least, take a mental health break. Up until this point, you probably spent more than half of your life in school. So if you just need to take a break while doing some of the other things that I mentioned, that's totally fine. As long as you're spending this time doing something that it will help you become more competitive for PA school, that's all that matters. They're not going to look at this negatively. It's not going to impact you in a negative way. As long as you're doing something and that reflects on your application, that's what truly matters. And that's something that the admissions committees typically value as well. I just wanted to put a couple questions just in case some of you needed this reality check. And again, this is for those who are still considering whether or not to take a gap year. So, something I encourage you to think about is, or ask yourself, are you applying because you feel ready or because you feel pressure? Also, an important question is if you had to reapply, will you still pursue this path? So take a moment to think about these things. I talk to so many students where they tell me that they feel like they need to apply right away because otherwise they're not going to apply to PA school. And I always wonder if this is the real the career path that you want to pursue, if this is your passion, you're not going to change your mind. So be realistic, really think about your intentions and what you want to do, and think about whether or not it's the right time for you to apply. Okay, so here are some takeaways from today's presentation, or in case you just needed to hear this. Start somewhere, but start. Please. That's the most important thing. I know it's scary, especially because it feels so overwhelming at first. But the most important thing is that you start somewhere. You're not gonna have all the answers right away. Those are gonna come as you go. So start somewhere, but start. Also, make sure that you do your research with everything. What does a PA do? The PA schools here in Texas or outside of Texas. Look into the prerequisites. Look into different opportunities out there that align with the things that you want to do, with the things you need to do. So research, research, research so that way you can make informed decisions. Make time for reflection each semester academic year, which is something I mentioned earlier, and also approach experiences with an open mind. This is very important. Sometimes we come across an opportunity or we land a job that we don't necessarily love or enjoy. So it's always good to think about, okay, like what is something that you can learn from that experience? And even the bad things or the not so good moments, those are lessons too. So, approach experiences with an open mind. And also surround yourself with people who inspire you and support you. It gets very overwhelming, it gets very stressful. So, again, that's why finding your community is going to be very important. And then also, you can rely on your academic advisors, on our office. There's so many resources on campus that you can use. So, surround yourself with people who do inspire you and support you. So, hopefully, the load feels a bit lighter. Networking, of course, we talked about that. And your journey is your own, as I mentioned before. So own it, okay? It's hard not to compare yourself with others. So again, like just because your journey looks a bit different doesn't mean that there's something wrong with it. Seek guidance when needed. And last but not least, academic excellence is important, yes, and you should prioritize it. However, there is much more to gain from your Aggie student experience. So keep this in mind, especially if you're just starting. Remember that all these things are important. Your professional growth, your academic performance, but also your personal growth. All of that matters too. So there's so much more to Aggie Land, and my encouragement here is for you to take advantage of your time here and do the things that you enjoy as well. Okay, so these are some campus resources I wanted to highlight. Of course, I wanted to talk about the Career Center. So if you again need help with major career exploration, you can schedule an appointment with someone on the Career Center. They can have those conversations with you. Also, they do offer career assessments and they can help you with your resume and cover letter, especially when it's time for you to look for jobs. They also host a lot of career fairs, encourage you to attend those, and they help with interview preparations too. So here's the QR code if you're interested in learning more about their virtual drop-ins and making one-on-one appointments with them. And of course, it's the professional school advising office, which is my office. So here, if you want to make an appointment with us, with a pre-health advisor, you can call our number and talk to one of our staff members, and they'll help you find a good time and day to meet with an advisor. Also, our office does a lot of workshops throughout the year, recommend for you to attend, as well as events. We also host the Health Professions Fair that happens early spring. So highly recommend for you to attend that as well if you can. And there's so many other resources, handouts, and also there's a section for frequently asked questions and so much more. So thank you so much for being here. I hope that you found this helpful. And again, I wish you the best of luck and know that this is something that you don't have to do alone. You have an entire team supporting you. So thank you again, and I hope that you have a great day.